Every 40 seconds, someone in America has a stroke. But survival doesn't just depend on the doctors. It depends on what you or your loved one do in the very first 3 minutes after the symptoms start.
If a stroke strikes, panic is your worst enemy. Today, I am going to teach you the 3-minute survival trick to protect your brain.
Medical professionals say time is brain. Millions of brain cells die every minute during a stroke, but you can slow that down.
Subscribe to SeniorStrength. We provide life-saving health strategies for seniors. Hit the subscribe button to prepare and protect yourself today.
Because you cannot know which one is happening at home, you must never try to medicate a stroke yourself.
The absolute first step is calling 911. But what do you do during the 10 to 15 agonizing minutes while you wait for the ambulance?
Most people sit frozen in fear, or worse, they do things that actively accelerate the brain damage.
That is where the 3-minute trick, or the brain saver protocol, comes in. Let's break it down step by step.
Step 1 is immediate positioning. Do not try to walk. Do not try to drive to the hospital. Drop to the floor safely.
Walking increases your heart rate and your fall risk. A stroke often causes one-sided paralysis, making falls deadly.
Once on the floor, you need to get into the modified recovery position. Lay on your side, preferably your non-affected side.
Why your side? Because a stroke relaxes the throat muscles. If you lie on your back, your tongue can block your airway.
Use a pillow or a rolled-up jacket to elevate the head slightly. About 30 degrees.
Elevating the head reduces intracranial pressure if the stroke is a bleed, but still allows blood flow if it's a clot. Panic causes rapid, shallow breathing, which actually decreases the oxygen in your bloodstream.
You must force yourself to take deep diaphragmatic breaths. Inhale through the nose for 4 seconds.
Exhale through the mouth for 6 seconds. This long exhale is the secret key.
The long exhale stimulates the vagus nerve, which violently drops your blood pressure and heart rate.
Spiking blood pressure during a stroke acts like a pressure washer on fragile brain vessels. You must stay calm to lower it.
Step 3. Unfasten anything tight. A tight collar, a tie, or a tight bra restricts blood flow to the brain.
Loosen your clothes immediately to allow maximum, unhindered circulation through your carotid arteries.
If you are alone and can safely reach the door before dropping to the floor, unlock it.
Paramedics lose precious minutes breaking down doors. If you can, make sure they have a clear path to you.
Now, we must talk about the fatal mistakes people make during these critical minutes.
Only a CT scan at the hospital can tell you what kind of stroke you are having. Do not play doctor.
Mistake number 2, drinking water or eating food.
Strokes frequently paralyze the swallowing muscles. Even a sip of water can go straight into your lungs, causing you to choke or develop pneumonia.
Mistake number 3, thinking you just need a nap. I feel dizzy and numb, I'll just lie down.
Let's rewind to the 911 call. What you say dictates how fast they get to you.
Do not just say, "I feel sick." You must say the exact words, "I suspect a stroke."
Activating the stroke protocol.
My arm went numb at exactly 2:15 p.m.
Doctors have a clot-busting drug called TPA, but it can only be given within a 3 to 4.5 hour window. The clock starts at your first symptom.
How do you know for sure it's a stroke? Let's review the FAST acronym, but add a new letter, B-E-F FAST.
B stands for balance. Is there a sudden loss of balance or a severe, unexplained headache?
Dizziness that comes out of nowhere is a massive red flag.
E stands for eyes. Has there been a sudden loss of vision in one or both eyes, or double vision?
F is for face. Ask the person to smile. Does one side of the face droop?
A is for arms. Ask them to raise both arms. Does one arm drift downward? S is for speech. Are they slurring their words?
Ask them to repeat a simple sentence like, "The sky is blue."
T is for time. Time to call 911 immediately if you see any of these signs.
But understand, strokes don't always look like they do in the movies.
Sometimes the only symptom is sudden, profound confusion, not recognizing a spouse or forgetting where they are.
Seniors often dismiss this as just getting old or being tired. Never dismiss sudden neurological changes.
What if the symptoms go away after 10 minutes? That is called a TIA, or a transient ischemic attack.
Do not celebrate. A TIA is the loudest warning siren your body can produce.
About 1 in 3 people who have a TIA will have a massive, disabling stroke within days or weeks. Even if you feel 100% back to normal, you still go straight to the emergency room.
Since time is brain, you need to prepare your home today while you are healthy.
Create a vial of life or a medical file and stick it to your refrigerator. It must contain your current medications, especially blood thinners, your allergies, and your emergency contacts.
The refrigerator is the very first place paramedics are trained to look for medical information.
Also, set up the medical ID on your smartphone so it can be accessed without a passcode.
If you are the caregiver witnessing the stroke, your job is to be the anchor.
The stroke victim is terrified. If you panic, their blood pressure will spike. Speak in a calm, low voice. Hold their hand. Stroke victims often feel profoundly isolated because they are trapped in their bodies. Physical touch grounds them.
While waiting for EMS, gather all their pill bottles into a bag. The doctors will need to see exactly what they take.
Women over 60 often experience different, atypical stroke symptoms.
These can include sudden nausea, vomiting, severe hiccups, or sudden general weakness. Invest in a home blood pressure monitor and use it twice a week.
Atrial fibrillation, or AFib, is another massive risk factor. It causes blood to pool and clot in the heart.
Many modern smartwatches can actually detect AFib before you even feel it.
Let's review the 3-minute trick so it is burned into your memory.
1. Call 911, state code stroke, and note the exact time.
2. Unlock the door, drop to the floor, and lie on your side with your head slightly elevated. 3. Loosen tight clothing and begin deep box breathing to flood the brain with oxygen and lower pressure.
4. Do not eat, drink, or take any medication. Wait for the professionals.
I want you to mentally rehearse this process right now. Close your eyes and visualize it.
When a crisis hits, you don't rise to the occasion, you fall to the level of your training.
Knowing exactly what to do replaces fear with action.
If you live alone, consider a medical alert pendant. If you lose speech, you can still press a button.
It is not a sign of weakness. It is a tool for independence.
If you or a loved one has already suffered a stroke, know that the brain is incredibly plastic.
Through neuroplasticity, healthy brain cells can actually rewire themselves to take over the jobs of damaged cells.
Recovery is a marathon, not a sprint. Every bit of physical therapy matters.
It is normal to feel depression or anger after a stroke. Do not suffer in silence. Join a support group.
Your body talks to you every day through twinges, aches, and energy levels.
If you listen to your body when it whispers, you won't have to hear it scream.
You now have the knowledge to be the calmest, most effective person in the room during a medical emergency.
That is what SeniorStrength is all about. Not just physical strength, but mental resilience.
Do you have your emergency contacts listed on your fridge? Let me know in the comments below.
I challenge you to create your vial of life today, before you go to bed.
Please share this video. Send it to your spouse, your children, and your senior center.
Forwarding this link could literally save someone's life this week.
Please. Always talk to your primary care doctor about your personal stroke risk factors.
Stay prepared, stay calm, and take care of your beautiful brain.
Be fast. Breathe. Survive.
Stay strong, and I'll see you in the next video.
Want to prevent a stroke before it starts? Click here to discover the top 5 foods that naturally clean your arteries.